My name is Jeff Poulos. I am the CEO of Philanthropy, Massachusetts, newly named Philanthropy, renamed from formerly named Associated Grantmakers. And I'm delighted to partner with our colleagues today on this closing panel. We will be a scintillating panel to get you to stay and come to the reception following us. So we're really pleased to be working with Nonprofit Finance Fund, local partners that we've worked with them on a number of programs. And a couple of years ago, I think, right, or like maybe it was a year and a half ago, Sandy McKinley and I had coffee and we were talking about like what's next, what can we do together? And this program had already sort of been gestating, and so we said we want to be part of that here in Boston. So thank you for partnering, letting us be a partner. We hope to use this 50 minutes here to provide some illustrative examples of organizations getting to impact and using this theme as food and health as an example. But I'll make a caveat to say that the work that we're going to talk about, it's working in concert with each other, and that no one determinant can be addressed in isolation. For this discussion, although we're focusing on food and health outcomes, we hope it's going to give you some illustration of it. We know that there are other elements to getting to healthy outcomes. So I'm going to move right to the panel because in the interest of time, we have a lot to talk about. First, I'll introduce each of them, and then we'll get to a couple of key questions. So on my left, immediate left here is Catherine D'Amato, President and CEO of Greater Boston Food Bank. To her left is David Waters, CEO of Community Servings, and to his left, we went boy girl, is Ashley Stanley, founder and executive director of Lovin Spoonfuls. So thank you all for being here. And I know many of you know our panels and their work, but I'm just going to ask them to quickly just share just a few sentences overview of some of the key aspects of your work, mission, key activities. Don't get into stories or outcomes yet. We'll get to that next question. But and I'll start with you, Ashley, down at the end. How's
Great.
that?
Well, thanks for having me. This is a nice chance to catch up with you guys. Lovin Spoonfuls is a nonprofit food recovery organization. So we take food that's otherwise being thrown away from the large retail shelf, and we upcycle it into the social service stream, working with over 140 nonprofit partners, including Community Servings and the Greater Boston Food Bank. And with a nod to some of the earlier talks throughout the day, we really approach this from a logistical standpoint. So we're trying a little bit to reframe the distribution aspect of hunger relief and what that looks like.
Thank you, David.
Sure, thanks. It's great to be here. Community Servings is a food and nutrition program for people who are sick and can't feed themselves. We feed about 2,000 people a year across 300 square miles of Massachusetts, out as far as Worcester, up to Lawrence and Lowell. All of them are living with an illness where they're too sick to shop and cook for themselves or feed their families. We would come in and feed the whole family. But the two key pieces is that sick people have no appetite. So if you bring them kind of institutional food, they're not going to eat it. So all of our food is made completely from scratch, accessing resources from both of my wonderful colleagues here and their institutions, but then medically tailored to their particular needs. So we can offer 15 different medical diets for our patients every day, but you can access 3 of them in the same meal. So you have diabetes that leads to kidney failure, you have a stroke. We can control for glucose, potassium, phosphorus, and vitamin K in your meal. So the food becomes much like a prescription.
Thank you. And Catherine.
Great. Thanks as well for being here, and it's great to be on a panel with 2 folks that you collaborate with all the time. The Greater Boston Food Bank serves eastern Massachusetts, 9 counties, 190 cities and towns through a network of about 550 agencies. One way to think of us is as a supplier, the acquirer, store, and the redistributor of food, which is why we work so well with my colleagues here. I think the significant piece is it's the equivalency of about 52 million meals going out, so 63 million pounds of food. I think the biggest changes, which we'll talk about, is the role of fresh in that industry, which has changed dramatically in the last 10 to 15 years. And then lastly, the move towards health, from hunger to health.
And we'll just continue on that as we move from, thank you for the overview, but now to programmatic work, and as you're thinking about getting from not just service, but to outcomes. If you could talk about either, a program or programs or activity that is an illustrative example, perhaps, that is results-based, and I'll start with you, Catherine. What are the goals? What are you learning or have learned along the way?
Well, as other speakers have done very well to say, it's very difficult to prove that healthy food gets you to a healthier outcome, and David has done some amazing work on this as well. There's a lot of very good work going on. I think for us as the Greater Boston Food Bank, because we're feeding and providing food to so many different organizations on a continuum, there's some packets at the end if you want to grab one, but we did the first state study on the cost of food insecurity and hunger. So for Massachusetts, it's $2.4 billion. And in this packet is a little infographic that shows you the illnesses. And if we addressed some of the illnesses, which is the work examples that each of us might be doing in different ways, then you can impact the cost of healthcare. So at $2.4 billion, the people's money, that's what we spend. It's not what insurance providers spend or what hospitals spend. But so that's an example of this is going to be hard to do, but stepping out and saying we have to at least identify what that cost is gets the attention of funders in a very different way than we're going to keep feeding you. We have to feed you better food. We have to feed you and have access to better food. So what we're learning at the food bank is that we need to have consistent access to fresh and healthy foods on a regular basis for those that need them. You need the policy changes to impact cause and effect change. And of course, that relies on good research to prove that.
Great. Thank you.
We're just beginning this. Well, we know how to get food to people. That is not the issue. We know how to do that. We know how to do that really well. 62 million, 65 million, 68 million pounds of food and healthy food. The question is, how is that food cause and affecting change? And that's where we're learning a lot from David's work.
And barriers? Do you think there's some barriers right now?
Barriers, it's stated before, income inequality is a huge one. Again, access, where you're born, where you live, these kinds of barriers to food. Food is the least costly intervention on your health. Absolutely the least costly intervention. Why do we not solve this problem? As noted earlier from the speakers beforehand. So what we're saying is that when there is consistent access, and again, I pick on you, David, because you know this research really well. David's model is a medicinal therapeutic model, just like BMC's pantry. Why are hospitals around the country not doing therapeutic pantries? They're proven. But you won't give up an ER unit or a cardiac unit or a something unit that's going to bring a lot of money from the payer side versus the food side. So I think we have a lot of work, but in my system of Feeding America, which has 200 food banks in the country, this is a big sea change for them and for us to be thinking about food as the intervention. It is beginning. There are models. I think of this as the Wild West. David's been in the Wild West for some time, but when he started, you were nuts. Right? Now he's normal. So I think that's a change in the food system, is what was unacceptable, illegal, and not good for you in the 70s. I'm a child of San Francisco, mid-70s, is good for you, legal, and the best thing you can do. Think about it. Avocado toast is not a new invention. I ate it in 1973. And we all ate kefir in the 70s too.
Sounds like you're talking about medical marijuana.
Yeah, that's right. Well, that too. That's legal too, but that's a shift, right?
That's a different panel.
That's a different panel, yeah. You should tell us about that. Tell us about that.
You really set David up here.
Yeah, I did.
I'm going to just step
He's
off the
good,
stage
though.
now
He's
because I think
good,
she can do this. He is great, and I think so. We're going to move from east to the Wild West over here.
There you go. There you go.
Like, if you could sort of.
Yeah, so at community service, we were faced with two things. One, we all know that we've been dealing with hunger in this country for 5, 6, 7 decades. And we've used government entitlement programs and we've used philanthropy. And we're blessed to work with many of you in the room. But at community servings, we could never meet the demand. We always had a waiting list. We're the only program that does medically tailored meals in New England. And we serve 21 communities. You know, great to serve 300 square miles, but think of 6 New England states, what the need is. We knew that we could never raise the money, and we always have at least 150 people on our waiting list. These are people who are sick and dying. They can't wait for a meal. They need it today. So where we looked was, well, we really think we're not just an anti-hunger organization, we're really a healthcare organization. We all know that an apple a day keeps the doctor away, or whatever aphorism you want to use. We set out to prove it. So at Community Servings, we went to healthcare leaders, we convened payers and hospitals and doctors and said, what would it take for the healthcare system to pay us to feed sick people? You decide who it is, you decide how long, you don't feed everybody, but what would it take for you to do that? And they all said, rightfully so, you'd have to prove an ROI, a return on investment. So we said, okay, we'll go do that. And we found a doctor at MGH, Dr. Seth Berkowitz, this was his field, food insecurity and health. And we looked at claims data for people we'd already fed, looking backwards, and looked at them versus a control group to see what the savings might be. And of course, we had our fingers crossed because sort of like that reputational reference in the last conversation, what happens if it doesn't work? But what we saw, as any of us probably would expect to see, is a 16% cost savings. And these are the most expensive patients, what are called high cost, high need, or superutilizers. We saw a 16% cost savings. That was less ambulance usage, less ER visits, and less hospitalizations. And now, in our most recent study, also less referrals to skilled nursing. Those are the most expensive things that healthcare is struggling with right now. And if something as simple as a prescribed meal for an expensive patient could be the thing that keeps them out of the hospital, then we really feel like we've hit on something exciting. And so, not to jump ahead, but we're now working to scale this both locally and nationally because we think we're already seeing insurers line up here and in other cities to say, this is going to be cheaper than anything else. And I'll just say, if we prevent one night in the hospital, we save enough money to feed a low-income, sick, isolated, hungry person for 6 to 12 months.
It's significant.
One night in the hospital.
It's significant.
So, did you have a second example you were giving us, or no?
No, I have a story, but I'll wait.
We'll wait for that. So, Ashley, tell me, from your perspective as direct service provider, about the program and getting to results, getting to outcomes.
Sure. So I think when you're thinking about giants in the field, like Greater Boston Food Bank and community servings, when you're thinking about that, you're thinking about product and end user. And for me and for Lovin Spoonfuls, what we wanted to do was honor and value the product and how it moves to set our partners up for success. So to us, hunger is not a problem of supply. It's a problem and a solution of distribution. So how do we create best practices and a logistical consistency around that distribution? And I think Angela was talking about the value proposition earlier, and you know, I bang my head against the wall sometimes because you sit in a room and you talk to folks about the value of this food, right? And the food that we work with is primarily perishable. It's healthy food, really trying to inject an element of health and the ability for folks to access that health. So we've designed our organization and the model around climate control, temperature control, standard of practice, standard of product, and ultimately by valuing the food, you value that end user. The value proposition in that takes a bit of a sharp deviation from the general language and framework of philanthropy, charity, hunger relief. And it really says the ROI and the ability to do this work ought to be valued as any other business. Because food is the most accessible, or should be the most accessible, because it is the most produced resource that we have. And the food that we are working with is post-retail. It's already been produced. We're not looking to create additional product. We're looking to really upcycle and take that idea, that 30 years ago, we did with recycling, and now has become, federally mandated practice. Putting the blue bins at the end of the driveway and getting your employees to spend a few extra minutes and manpower to recycle was not something that folks could get behind right at the beginning. But the promise, the ROI, was that this was something that could potentially be socially investable, and that there would be that ROI. And here, when we talk about health, that fresher, healthier food allows people to go further, and the ripple effect, education-wise, health-wise, productivity in society, it's almost endless when you think about it.
As you describe this, I wonder if you have an illustrative, a client or a story that you could share with us that might just, really send it home here.
Sure. And if anyone in the room, I'm sure people do, a dear friend and a partner of ours, the recently passed Raheem Baraka, had Baraka Community Wellness, a great partner of Lovin Spoonfuls, and we miss him dearly and honor his work. One of the programs that Baraka Community Wellness has is their Healthy Moms, Healthy Kids program. This program was primarily resourced by Lovin Spoonfuls for fresher, healthier food. And they had one young woman who was coming through. She was newly pregnant. She was on 10 different medications. She was unhealthy in many different ways. And through this program, and through her access to better food, by the end of her pregnancy, which it was a healthy pregnancy and a healthy delivery, she was not on any meds anymore, and it was completely controlled by the food that she was putting in her body. And that was something that said to us, if we look this was a micro example, huge in terms of the outcome and the promise of this woman's life and her baby's life. But if you think about that, the idea that food is an incredible multiplier on so many different levels, what does that do just with the choices that one can make without spending thousands of dollars on a number of different treatments, medicines, this and that we can sort of heal ourselves from the inside out. And that was something that said to us, how do we shift some of our metrics? I think we could all come up with a number of different quantifiers, pounds rescued, people fed, this and that, calories rescued. But how are we determining this in terms of health? How healthy are people? How many more folks are living longer? How much more is medicine working inside a nourished body? Things like that.
Great. Shifting the question a little bit about the model, the design of the work that you're doing, and thinking about partnerships, working with funders, or is there have you worked in the design or goal setting with funders at all, or have you, if not a funder, was there a funding model that might have been a component of the work that you've done? And I'll open it to any three. Yeah, Catherine.
Separate from the food bank, because of this work, as David said, there's thousands, and Ashley as well, it's 150,000 people eat something from the Greater Boston Food Bank through their organizations and many others. But as part of this work, the Greater Boston Food Bank has established something called the Hunger to Health Collaboratory, and it has 8 partners. And as noted earlier, these are not your usual suspects. It's just Good Housekeeping and Museum of Science and Babson College and the Greater Boston Food Bank and Stop and Shop. And it's a well-funded, for a period of time, all are welcome. But Stop and Shop has been the lead on this and giving multiple millions over this set of years to try to reduce the health consequences of hunger. So it isn't just about, again, the giving the food, that we've all evolved to saying it has to be intentional, or it has to drive down, whether it's the usual suspects of diabetes and obesity, but the unusual ones are poor health condition, pulmonary disease, depression, suicide. There are a number of factors here now where the social determinants, again, they seem to be cool today, but they've been around for 25, 30 years. But now we're talking about them because their least costly intervention is to attack those. So I think for us, we're talking to funders about those upstream solutions, and the collaboratory is just beginning to get its work together, and partly there will be a gathering here in Boston next year, and just trying to bring people to share models like David's, to share food rescue models as well around the country, and many other things that are happening. There are some amazing things going on in the country. They're not being paid for by health insurers or payers, and that's where David's work and others like him are really leading the way. Why should food pantries not get credit for the distribution of fresh fruits and vegetables to low-income populations? Doesn't make sense to me. I mean, now 36 almost % of our distribution is a fresh fruit or vegetable. When I started in San Francisco in 1979 at the San Francisco Food Bank, our first donation was number 10 cans of banana puree. Now, we thought we had made it because we had a first donation and you didn't say no. Then today, we all have nutrition policies. We purchase food. I'm purchasing $25 to $30 million worth of food. I am not reliant on the donated system. If you want to cause an impact change on the diet, you have to look at those particular products, and they have to be consistent. So those are some of the things that our models are coming in differently. Donated food is on a steady decline in our country thanks to rescue, thanks to policy, thanks to industry waking up and thinking differently, and it's the way that its philosophy is. When you have Stop and Shop put a $25 million anaerobic digester in Freetown, Mass., I assure you the donations feed the digester. That's a good thing in one way. It produces 40 to 50% of their energy for 1 million square feet. On the other hand, they're likely to give money today than they are food. They're still committed to the cause, but not with product donations because organizations are doing really good work. So things are shifting. I think it's the most significant time in this issue of hunger and in this issue of the food industry. It is the gap is narrowing. So in terms of the understanding, and I think the kinds of partnerships, your work is going to tip so much that others will be in line while David will have led the way. And then they will eventually reap the benefit of that kind of reimbursement from an insurance company. Some insurers are paying for CSAs in their communities, or they're paying for the distribution of produce, or they're paying for models like David's. He can prove that I can help you become healthier by the food that you're putting in your mouth. I'm there to help him get that produce. I'm there to make sure he has a consistent supply, right? Because that's what he needs.
Let me ask, so there are organizations in the room that are trying to think about how to shift to a results-based or outcomes-based model. And so I wonder if you have some story to tell or some example you can give about how you shifted your thinking, how you shifted your organization to get there, and then people might be able to sort of learn from that as an example.
Absolutely. So we're thinking about funders and partners. We have lots of incredible philanthropic partners: Bank of America, RWJ, Nonprofit Finance Fund. But I think the interesting puzzle is, if we're able to find a way for capitalism to feed low-income sick people because they're going to save money, then how do you scale this?
Yeah.
And so working with Nonprofit Finance Fund and others, we're really looking at how do we take our model and bring it to New Orleans or Detroit or Cedar Rapids, where there isn't a philanthropic base, there aren't corporate headquarters, they can't sustain this via philanthropy, but they have a health insurer. And so we just have to take food programs, nonprofit food programs, and help them scale up and do complex medical diets. So to layer 3 different diets in the same meal is fairly sophisticated, not just from a cooking perspective, but from a logistics perspective. So what is it around the logistics of shipping or delivery, bringing people into the workforce that will help us to do more of this. But then what we're seeing, which is really interesting, is that if we're going to partner with healthcare, they expect us to look like healthcare.
It's true.
They want to work with us because we're community-based organizations. We've got boots on the ground. We know the community. We're in the client's home every week bringing the meals. And yet they're also saying you have to have the same data security standards, the same HIPAA standards of the big insurers, United Health or somebody like that. Who's going to help us do that, and where's the money to do that? We're all in. This is our business model. We're getting there, but I think that's the challenge because we're in the room here thinking about systems. I think it's where's the system that helps that happen, because food in the context of healthcare is so obvious. Everybody knows that this makes sense, right? But if we can't operationalize it in more than 12 cities, which is where it is now, it's not going to have the savings that we could really see the magic happen. And I think that's the challenge I would call anybody in the room to say, help us figure this out, because we can really change hunger and healthcare and nonprofit business models if we have the help.
Well, and to attract further investment from multiple different sources, too.
But if it only feeds your own, that's part of the problem, is that if you're holding on to something that is the same, then you'll be left behind. There's so much exciting work going on. It's just who's paying for it and the scalability, I would agree. I mean, when you have, in my world, the Chicago Food Depository had Kate and Eric call me and say, can you make an introduction to me to this guy named David Waters in your community? Because we're building out $50 million of our kitchen and I'd like to come learn from him. You do that in a nanosecond. Because anytime somebody wants to scale like that, that's pretty amazing. But again, the changes in the industry are dramatic. For the first time, Boston has Rev Foods, which is a fresh foods model. For better or for worse, whatever you think, that's a very different model to feed public school children than frozen. That's a huge change. And that will have dividends for those children's health for years and years and years to come. We won't know it, but for many years to come. The difference between eating a frozen product coming from another state every day to a heating kitchen versus a scratch kitchen.
To build off of that too, something I learned from our friends at NFF is looking both at the downstream and the upstream.
Yeah.
And we live downstream, which is we're helping someone to recover from breast cancer, or if they're going to pass with dignity, knowing that there's people coming to their door and there's food there. But the upstream of that person's child who isn't going to be fed because mom's on the couch because of chemo and is too weak to feed them, so the state takes the child away, even though mom may get better. That child's not going to learn if they're not well fed. We all know those things. So for us to feed the whole family during a health crisis has that elastic upstream and downstream impact. And I think it's tremendously impactful.
I'm going to ask people, those of you out there who want to ask a question, to come up to the mic while I turn to this other question here. I want to ask you the same question that I started here with, in terms of as you think about how your organization thinks about whether you shifted to a results-based or outcomes-based model, what advice you would give to people in the room about thinking about that for their own organization?
I think our partners tell our stories about results and outcomes because just of the nature of how we work. And just I think this is all connected, but at the very beginning of this, well, it might not have been the beginning of the conference, but it's the beginning of when we got here. When Matt from Homestart was up here, somebody had come up and asked a question and said, I go to these conferences and I see these really passionate founders and executive directors, and how do we, it seems that all the information is there. Why can't it just happen? Why can't, things manifest in other cities and all that? And certainly at Spoonfuls, the idea of replicability for us is geographical and it's financial. And in that question, I think what's so unique about what's happening right now in hunger relief and hunger as it relates to health, there's an awareness about where food is coming from, the actual multiplying power of food as a biological necessity and as a biological driver. And so I really think it's incumbent upon us, the way we run our businesses and the way that we fundraise and operationalize our work and look to expand, to really think about what can be done down the road for both the upstream and the downstream effect, because we have the information. There's nothing blind anymore about hunger, right? So we know where it is, we know where it needs to go, we know what needs to happen to connect all of these resources. We have to do a better job in terms of looking at the full sort of 360 idea about what the effects are pre and then post. And so I guess I would say that anything that we are doing or anything that anybody else is doing around this really has to do with having sort of the long view and being able to intentionally and strategically build towards a potential goal without having a ceiling that caps you at that. And I think that's what's been really unique and I think sort of exceptional, at least about the relationship between Lovin Spoonfuls and the Greater Boston Food Bank, because we are not feeding America. And we have an MOU that's about 3 years old now, the first of its kind in the country that allows two organizations within the same space, but one is outside, sort of an umbrella, to work together to figure out how to fill the gaps. And it's remarkable when you think about it, because I imagine when Catherine began her career, and mine notably shorter, about only 10 years, but thinking about that, those two things would have never happened. And the power of that is sort of that macro long view of the impact of what can be done because we have the information, and what are we doing with that information.
I mean, we get calls all the time, can you send us the agreement? You get along with your food rescue program, what's going on in Boston? And the answer is yeah, because it's not a single solution. None of us are the solution, it takes all of us. And then there are hundreds more there. And, you know, and if you do take a packet, there's this, we produce something called a checklist for hunger-free communities. And it really is just asking you to use a guide. And what it might be, in a community, it might be a medicinal meal program, it might be an elder, it might be a bus route, it might be a school meal. You don't know the answer. I just know we have a whole lot of food, and that food has become much healthier. You know, instead of canned goods, it's fresh and it's perishable and it's voluminous. I'm fond of saying at the Greater Boston Food Bank that when I came, we couldn't move a carrot. Mm-hmm. Not one carrot. Today, it's almost 35% of our distribution. So it's 22, 23 million pounds of produce today. That is a huge shift of what the consumer wants, what the organizations want, what the hungry person might need. And it's just dramatically changed. So I think that the collaboration is going to be more important, and then how we collect that data. So we're committed to 3 meals a day and to every town we serve. Let's use Boston as an example. The Greater Boston Food Bank puts enough food into the city of Boston to statistically say everyone in need has 3 meals a day. Statistically correct, experientially completely incorrect. You look at East Boston, you look at Alston Brighton, you look at parts of the city that are underserved versus overserved. But we count your meals into that, we count their distribution, and if I could count hundreds of other organizations, we could go to funders and say, it's actually going to take 8 meals a day, because 3 isn't going to work. So we're learning that. I think that's part of what we're learning, and we share a lot of data. So that's a nice way to be able to work together, to say, we think we've got most of the picture, but not all of the picture. I honestly think in our state, we're probably doing well over 2 meals a day across the state, but I can't prove it yet.
I think the other piece of that is for any other, I mean, even for the funders in the room, but other nonprofits, there's this big push for collaboration. And I was on the phone with a potential funder the other day who said, well, what about collaboration? And I said, well, we collaborate here, we collaborate there. And he's like, we only fund organizations that collaborate. And I was like, how do you define collaboration? And because one person working in a food-based business, regardless of what sector, suddenly winds up in the same pool that you're swimming in for rescue or,
Yes,
or
exactly.
food banking. And you're sort of like, because the word food, while it is a connector, it doesn't necessarily mean collaboration. And here, we have the ability to strategically collaborate. And when that happens, I think everybody's outcomes and results become greater. And that's primarily how we measure those outcomes and results. We can understand what needs to happen because not every partner is the same.
Yeah. David,
I'm gonna, oh yeah, well,
No,
first
go
I'm just gonna pause and see if anybody has a question. And don't rush the stage all at once, okay? Then go ahead. Nikki.
Just one there.
Yeah,
Just
wait,
one there.
did you have a comment? Come up to the microphone, right there in the aisle. And
David has to start.
then after you ask your question, I'll
Wants to
turn
tell
to
you
you.
stuff.
Introduce yourself.
Hi, Shannon Arnold from Family Aid Boston, and my question kind of touches a little bit on what Ashley was talking about. I'm curious, as you have moved your organizations towards a more outcomes-based model, you have the funders who are in the room, who understand the changes that you're making. I'm curious about what kinds of conversations you've had to have with other funders who might not fully understand that model, who might not fully understand the kinds of investments that you're having to make in your organizations. What kind of barriers have you encountered? What kind of conversations have you had to have?
Well, I could just say the kinds of conversations are frustrating and can often, not go the way you want them to go. I think one of the things that is shifting, though, and certainly we found this, we were lucky enough, and I know you guys were neighborhood builders as well. When Spoonfuls went through the neighborhood builders program, we were surrounded by other like-minded nonprofits who were looking for strategic funding partners. And that's what we found here. And that was something that really opened our eyes. On the one hand, refusing money is never a good thing. But at the same time, having leadership with funders, meaning funders who are sort of willing to take bold stances and say, what do you need? Especially for an organization like Spoonfuls, we are primarily one program, so it is general operating most of the way, and people say, well, we want to fund something really specific, so if you want us as a funder, you have to build it. And for us, we're a team of 15, and the amount of time it would take to create the program that would get funded, that would cost us more on the back end, those are the kinds of conversations that are just sort of realistic, and we have to be realistic about what we want and what we're willing to do. But I think what we're finding is there are more and more funders who are willing to be bold, willing to step up and say, tell us what you need. And that, frankly, has given us confidence as an organization and sort of the ability to stand up and say, this is what we need, this is what we're able to do, this is what we're able to sort of compromise on, for lack of a better term, but really making sure that we stay true to the mission and the ability to operate in ways that continue to serve our partners has remained paramount.
I think one of the challenges we face is finding individual donors. It's, corporate philanthropy leaders generally know the lay of the land and they know what fits within their giving area. But to find those individuals who want to be the philanthropic investor, we get an audit every year like everybody else in the room, and our board looks at it and says, when are we going public? This is as good as any for-profit financial report. And what I always think of is, where's that individual investor who's building the next healthcare innovation, and how do I get them to do it they're going to get a different return. They're not going to get a dollar return, but they're going to get an emotional return, a changing the world return. Right. And that's always, to me, the tease, because I feel like together and many of the other things happening in the room, we really are changing, society, economic models, hunger, these huge overlooming things. And yet we can't find the people who say, yeah, I'll give you the no strings attached money to make it happen because I see you know what you're doing. And that to me is the frustration, is I have to take it and whittle it down into this little funding program or this RFP, or I need somebody to say, I believe you, I'm going to give you $1 million.
Right.
I need them too.
Yes.
Okay, I just, all right.
Yeah, yeah. And there's one over here, too.
Okay, all right.
And I'll take the scraps.
It's like Shark Tank, we can get all the deals to come
That
in
is
for
a
all
piece
of
of
us.
the puzzle, is how do you take those nonprofit leaders and, I'm running a $100 million charitable business. If you look at me like David's P&L, I look like a food distributor. Food in, food stored, food out. And there's all kinds of ways. We cut every measurement possible. We know we're doing something better than was done before, but we are challenged by, did you eat that food? Or did you share it with your kids, your grandparents, your neighbors? I know that there's better food in the system, but did we actually cause and affect your health to change? So I think from a funder's perspective, I find them very savvy, and I find them very demanding. And we can't do everything. But I am seeing a shift, especially among industry, in the food industry, which I spend a lot of time in, that those donors, and they are more corporate than they are individual, are changing what they want to invest in. And they are seeing it as startup. They are seeing it as, let's try it on, there's going to be some mistakes. At least we're seeing that with the collaboratory. We have a funder that's with us to learn, which is very different than a funder with you to distribute X amount of pounds of food or X amount of type of food. So that to me is a big shift in the industry.
So final question, final thoughts, as we close out and go off to our closing remarks and reception, is words of advice, words of wisdom for our colleagues in the room about thinking more about outcomes-based approaches, particularly those that want to get started, or a story you might want to share, something compelling on your mind. You had a story you wanted to tell. I'll let you tell your story, and then I'll let Ashley
Great.
and then Catherine.
So we have a patient that we started feeding through a health insurance contract, one of our first health insurance contracts. This was a woman that every month when her food stamps, when her SNAP benefits ran out, her diabetes would go out of whack, her A1C would escalate, and she had one response every month. She picked up the phone, dialed 911, and had the ambulance come. The ambulance took her to the emergency room, they stabilized her A1C, and they sent her home. The cost of the ambulance, the cost of the ER visit, the potential hospitalization if it went out of whack, you think of what that costs us. And all it was that there wasn't enough food, and there wasn't the right food. And if there isn't the right food, then they walk to the bodega and they buy the highly processed food that's cheap, that's high salt, that's high preservatives, and it makes them sick. And we set them up to fail because this is what they have to do. And she got onto our program through her health insurer, and in the first 6 months, she never called 911 once. And you think of the savings to the system, but how do we get that message out there? Because what I see is everyone says, how come I've never heard of you? If you were really good at this, I would know you. You're not the BSO, you're not the MFA, you're not the opera. That's who I give my funds to. And we think we're changing the world, but unless there's a really loud trumpet to help us spread the message, and I say all of us, that's what we struggle with.
Yeah.
So you all have a job to do when you leave here today, is spread the gospel of community servings and greater food bank and Lovin Spoonfuls.
Exactly.
It's the way- it's the way-
So, final thoughts.
You said for people getting started or taking, so Spoonfuls will be 9 years old in January. And oftentimes we get sort of thrown into the bucket of like startup and entrepreneurship and all of the new stuff that's happening, whatever. And I think we're settling comfortably into our place as servants, as stewards of trying to figure out where we can be most helpful. And I think from day one, and I'll just reiterate what I said earlier, getting started, any kind of business right now, for-profit, nonprofit, public service, making new denim, like whatever you want, do it with intention, right? I think it's incumbent on all of us, the way we run our businesses, the way we start businesses, the way we spend our money, the way we donate our money, the way we invest our money, all of that. It's incumbent upon us to do it with an awareness of where we are in the world right now. I don't think, truly, this is just me speaking, I don't think we have the right to go out and just create things without an awareness of what's happening in our community. There are so many people in the world, there is so much need, and there are so many resources. The fact that we haven't really been able to connect them all and use them to advance us forward borders on criminal for me. So it's really about intention and strategy. And I think when we do that, running that thread in the fabric of everything we're doing creates outcomes. That's what matters.
David, final thought.
Yeah, the only outcomes we could find in the early years were client satisfaction surveys. And what we discovered was when you ask a poor, sick, hungry person, did the food make you feel better? Their thought is, they're going to take this away if I give the wrong answer. So they're going to lie or fabricate or just tell you what you want to hear because they're afraid you're going to take away their food. I mean, that's so obscene. And it wasn't until we realized that we didn't have the data, that healthcare had the data, that we were the outcomes and the savings. And that was the aha moment for us, was that if we could look at the insurance claims data for the patients we'd already fed compared to people we didn't feed. So I would just challenge you to think outside the box, that it might not be in your office or in your file drawer, or even in your client's hands to get the information. It could be something more systemic. And I think that was the story with the housing was the exact same thing. It was that the city had the data.
That's great, finding your other partners that may have that. Catherine, the elder stateswoman.
Bring it home.
Bring it home.
Good food insecurity is a matter of public health. It is a public health issue. And I think our challenge is that we work in various and different ways to drive that home. So I would think we would be successful in our outcome when a physician, a nurse, a clinician, a food provider, a school teacher asks you that food insecurity questions. Do you have enough food? And you don't, here's where you can go. How do we arm those caretakers in the same way that you do today at your annual visit? I'm asked, am I safe at home? Have I fallen? Is there a gun? Do you smoke? Do you drink? Do you wear your seatbelt? Do you have enough food? That should be a normal question asked. And I think when we get there, then the matter of connecting hunger to health will be somewhat moving in the right direction. Because then you can give people the resources that they need on a consistent basis, whether it's David's program or Ashley's program or the thousands of others that are there. So how do we make food insecurity a matter of public health?
Thank you all. I want to give a special shout out to my colleagues at Bank of America, who are the brainchild behind this amazing panel. And such a philanthropic leader in our community. And a special thank you to all three of you. You were tremendous, inspiring. Let me know when there's a job opening. I'm on board. And thank you all very much, too.